All right, how you doing today?
Good, how's it going?
Good. I'm Dr. Summers. What's your name?
David, nice to meet you, Dr. Summers.
All right, David. Today we're going to assess your spine from the back of your head down to your belt loop. If there's an area that needs further evaluation, may I expose the skin in that area?
Yeah, you sure can.
Okay. First, we're going to check the table. All right. Now, may I have you take off your shirt?
Yeah, sure thing.
Okay. And then you could sit here and just face the windows with your hands turned like that. Okay. And can I have you scoot down here just a little bit? Okay, so first to begin the assessment with a general scan of the pelvis.
What was your contact point?
My contact point was the medial aspects of the PSIS.
And then what was your line of drive?
The line of drive was at a 45-degree angle using my thenar eminence. I slightly pressed posterior to anterior, medial to lateral. Next, I checked the translation of the spine.
And what was your contact point?
With the loosely held fist, I contacted the spinous processes, the midline of the spine.
And what was your line of drive?
P to A along the translation of the spine. After I checked the translation of the spine, I moved to the cervical scan.
And what was your contact point?
My contact point was the articular pillars of C2 to C7.
And what was your line of drive on that?
I began superior to inferior, P to A, and moving upwards, P to A, I to S. Okay, David, can I have you stand up and then we're going to have you live face down for me? Is it alright if I tuck back your shorts a little bit?
Yeah, you can.
The independent movement of the ilium. My segmental contact point was the SI joints. I did check for anterior glide, while my contact point on the SI joint, I lifted up on the anterior superior iliac spine, checking for anterior glide. But for posterior glide, while maintaining my hand on the SI joint, I lifted at the leg, lifted the leg upwards. I also did medial and lateral glide, laterally and medially moving the leg. Evaluate the sacrum. In a fencer's stance, looking along the right oblique line, I began to palpate P to A on the left sacral base. From there, in the transverse plane, I palpated P to A on the middle sacral base, and after that, I palpated P to A on the right sacral base along the left oblique line. From there, along the right oblique line, checking counter rotation, I palpated P to A on the right apex, right of the sacral hiatus. From there, in the transverse plane, I palpated P to A on the sacral hiatus, and after that, on the left oblique axis, on the left of the apex, I palpated P to A. To complete the evaluation of the pelvis, I assessed both rotation and lateral bending. To assess lateral bending, I used the leg, I adducted the leg to check for lateral bending. As far as rotation, the side you are standing on is the side you are rotating. So if you're on the right, you're checking for right rotation. The segmental contact point in this is the interspinal space between L5 and S1. Okay, so David, can I have you sit back up and face the window here? You can come down to the edge if you want. Alright, that'll work. Okay. So, just. Alright, can I have you bring your arm back? Alright, you can replace it. So can I have you cross your arms? Okay, I'm gonna flex you forward. I'm gonna extend you back. Alright. I'm gonna rotate you towards me. Flex. Rotate you towards me. And flex you. So while checking the translation of the spine during the seated scan, I noted there was what felt like a restriction along the T8, T9 area. To begin to check for the restriction, I had the patient cross his arms across his chest like this, and with my index finger in the interspinal space of T8 and T9, I flexed the patient forward and then extended him backward, checking for the separation of the spinous processes. So after having the patient in flexion and extension, with the fat pad of my thumb along the interspinal space of T8, T9, I brought the patient into lateral bending and rotation on the side being examined. With the fat pad of my thumb on the interspinal space of T8, T9, I palpated medial to lateral. Okay, David, can I have you cross your arm for me? I'm gonna flex you forward. Okay, so to check for elevation and depression of the corresponding rib pair to T8, I began on the spinous process of T8. From there, I moved superiorly 2 interspinous spaces up and 2 inches lateral. To check for elevation, I brought the patient into flexion, and then from the inferior margin, I palpated I to S. To check for depression, I brought the patient into lateral bending and palpated or pressed from S to I. Okay, David, can I have you stand up?
Yep.
Alright, what we're going to do is I'm going to have you flex and extend your head, and you're going to stop once you feel comfortable in a neutral position. But I'm going to have you do this with your eyes closed.
Okay.
So you. Alright, you comfortable there?
Mm-hmm.
You look to be about neutral. Alright, I'm going to have you sit down. So inferior to the mastoid. So wide grip on the lateral masses. Check for translation. Okay. Turn this way. Here I just evaluated the translation of the atlas.
What were your contact points?
My contact point was the lateral masses of C1.
And what was your line of drive?
My line of drive on the left and right side was lateral to medial. Here I checked for the rotation of the atlas.
What was your contact points?
My contact point was the posterior arc of the atlas on both the left and right side.
And what was your line of drive?
My line of drive to check for joint resiliency, I turned the head to the right and pressed lateral to medial on the right side, and to the left, lateral to medial on the left side.